Good morning. I'd like to call a meeting of the Minnesota Senate Health and Human Services Committee to order. It's Wednesday, March 1st. No, it's not March 1st. It's March 15th. Sorry, the agenda states March 1st. And we do have a quorum present. Our first bill on the agenda is Senate File 1949. Senator Klein is here to present the sports betting bill. This bill, we have a very narrow area of interest in this committee, and I'm looking for the actual description of that. And maybe we could have counsel. Would one of you be able to just describe just the jurisdiction that is within this committee? I'd appreciate it. Okay.
Madam Chair, members, the areas of the bill that are within this jurisdiction will be Article 2, Section 2, Subdivision 7, Paragraph D, and Article 4, Section 2, dealing with the problem gambling program.
Thank you. Senator Klein, please go ahead.
Chair Wicklund, thank you, and committee, and thank you for hearing Senate File 1949 dealing with sports wagering. Madam Chair, I know you have a long agenda today. This is a big bill with a lot of significance. I will try to be expeditious. I'm going to speak just some general comments about the reason for advancing this bill at this time on its second stop through the committee process, and then I will address the areas of specific oversight of this committee. So the sports wagering bill I assumed as chief author this year for two reasons. First of all, because Minnesotans are demanding this as a recreational opportunity and are in many cases already accessing it. And it's the role of this Senate to create basic consumer protections around that to ensure that it's a safe, trustworthy process and has guardrails for problem wagering and underage use. I also assume chief authorship, and more importantly, for the reason of historical justice. Tribal gaming in the state of Minnesota has restored financial independence, power, and basic services to our 11 Native American tribes, which were devastated over the past 3 centuries. And protecting that exclusive right to gaming as it expands into new areas is essential to continuing that work. This bill is a work in progress, members, but one principle which is not open for amendment or discussion is that tribal exclusivity over the 11 licenses for sports wagering. The bill enjoys the support of our major league sports franchises, but as you may know, it does not at this time enjoy the support of the 2 racetracks in Minnesota. As chief author, I want to acknowledge that those tracks are a Minnesota destination experience, not unlike a trip to the State Fair or to the North Shore. And I'm committed to continuing to work with the tracks as the bill moves forward to try to achieve their support. To the bill itself and your area of jurisdiction, Madam Chair, the bill authorizes the Commissioner of Public Safety to regulate sports betting. It may be conducted through the internet or on tribal lands, subject to a new compact to be negotiated by the governor with the Indian tribes. Article 2, the section that Council described, specifies that 50% of tax revenue must go to the Commissioner of Human Services, half of which is allocated to the compulsive gambling treatment program established under current law, and half of which is allocated for a grant to the state affiliate of the National Council on Problem Gambling to increase public awareness of problem gambling. In the area of Article 4 that Council pointed out, it directs the Commissioner of Human Services to create programs for the treatment of compulsive gamblers and their families. This section allows the Commissioner to contract with an entity with expertise regarding the treatment of compulsive gambling to operate the program. The program established through DHS may include a statewide toll-free number, resource library, public education programs, regional in-service training programs and conferences for health professionals, treatment providers. May establish the establishment of certification standards for programs and service providers, inpatient and outpatient treatment and rehab services for residents in different settings, including a temporary or permanent residential setting for mental health or substance use disorder, and individuals in correctional facilities, and funds research studies, and the studies must include baselines and prevalence studies for use in adolescents and adults to identify those at higher risk. Madam Chair, I should have pointed out that those revenues will be generated through a 10% tax on sports wagering net revenue, half of which is allocated to these grants. And that is the bill, Madam Chair.
Thank you, Senator Klein. We do have 2 testifiers. Would you like to proceed with testifiers right now, and then we can go to questions.
That sounds fine, Madam Chair. I don't have the list at my desk.
All right. We have testifiers. They're both on Zoom. First, we have Pat Gibbs. And if you can, welcome to the committee, and please, if you can state your name for the record and begin your testimony.
Thank you, Chair Wickland, members of the Senate Health and Human Services Committee. Thank you for the opportunity to provide testimony in support of mobile sports wagering, and thank you to Senator Klein and the other supporters championing this effort. While the organization I represent has concerns with a few technical aspects of the bill in its current form, we remain committed to working with the sponsor and involved stakeholders to find language that best serves the state, the individual players, and the sports betting operators and platform providers. We are very optimistic about Minnesota's chances to pass strong sports betting legislation this session. My name is Pat Gibbs. I'm an attorney with the law firm Orrick, Harrington, and Sutcliffe, and it is my pleasure to serve as National Public Policy Counsel for the Sports Betting Alliance, or SBA. The SBA is a trade organization comprised of many of the top companies in the mobile sports betting industry: DraftKings, FanDuel, BetMGM, and Fanatics. Together, our members advocate for competitive mobile sports betting in the United States. I will keep my comments brief, as I know the committee is limiting testimony to topics related to Article 2, Section 27D, and Article 4, Section 2. The SBA does not have a formal position on how Minnesota or any other state should allocate its sports betting tax revenue, but we understand the importance of responsible gaming and recognize the important role the state plays in ensuring that individuals have the tools and resources to responsibly participate in all forms of gaming. Like the program to be established by the Commissioner of Human Services in Article 4, Section 2, legal operators, like the members of the SBA, offer educational materials from their mobile platforms directly to customers to help them make informed decisions about how to bet responsibly, including access to online resources and a toll-free helpline. Our member companies provide employees with responsible gaming training on a regular basis. This begins on day one. We monitor betting activity and intervene when necessary, and we support funding with evidence-based research and responsible gaming research. Most importantly, we engage with policymakers, problem gaming treatment organizations, researchers, and customers to promote responsible gaming and address problem gaming. With the regulated competitive mobile sports betting market, Minnesota will develop a safer environment for its about 1.1 million existing sports bettors and many other gamblers to operate within. This brings in the best known brands with top-of-the-line consumer protections and state compliance to replace the predatory illegal platforms already here, and does it so in a way that generates revenue for the state. Thank you for allowing me the opportunity to provide testimony. I'd be happy to answer any questions you may have.
Thank you. Thank you for your testimony. Next, we have Benita Fitzgerald Mosley. Again, if you could please state your name for the record. Welcome to the committee.
Good morning, Chair Wickland, Senator Klein, and members of the Minnesota State Health and Human Services Committee. I'm Benita Fitzgerald Mosley. I'm the Vice President of Community and Impact at League Apps, which is a youth sports management technology platform, and also President of Fub Play Foundation, a newly formed foundation that gives away our technology for free to organizations in underserved communities. There are 35 youth sports organizations in Minnesota who run their leagues and clubs and teams on the League Apps platform. I'm also Executive Director of the Play Sports Coalition, representing nearly 4,000 youth sports organizations across the country, 65 of which live and work in Minnesota. I'm the former CEO of Laureus USA, which supports youth sports nonprofits in underserved communities, and I'm also a 1984 Olympic gold medalist in the 100-meter hurdles. We support the provision in Senate Bill 1949 that would allocate 50% of the tax revenue from mobile sports betting to the Amateur Sports Integrity and Participation Account. This would create a grant fund advancing youth sports programs in areas that have experienced a disproportionately high rate of juvenile crime. There are many challenges facing youth sports organizations and their families. Cost is the primary challenge to youth sports participation. Supporting organizations through grant funding, which will allow these organizations, many of whom, again, are serving kids in under-resourced communities, to operate and continue supporting and expanding to serve more kids. Free recreational sports are still available through Park and Rec programs and other places, but far less often now for some traditional sports due to the tremendous growth of pay-to-play clubs and travel teams And we've seen that burgeoning growth and how quickly they came back with a vengeance after the pandemic had relaxed a little bit. Minority children in particular have less access to recreational spaces and to youth sports opportunities. And the pandemic-related challenges for many of these smaller organizations continue. The benefits of youth sports are significant. It improves mental and emotional health of young people. A 2019 study found that children who reported no exercise were twice as likely to have mental health problems. And regular physical activity improves overall physical health as well, and it reduces the risk of chronic disease in many cases over a child's lifetime. Organized sports activity also helps children develop and improve their cognitive skills. They tend to do better in school, tend to have higher graduation rates, and matriculate on to college. Trauma-informed coaching and youth development techniques that focus on developing life skills for kids and improve education outcomes are infused in many of the sports-based nonprofits that may be prioritized for this grant funding. The intentional use of youth sports to achieve these outcomes can keep youth from getting involved in the juvenile justice system in the first place. And I expect that local sports leaders within the 65 Play Sports Coalition members and more in Minnesota would utilize the funding to serve more kids and to help them physically, mentally, and emotionally stay healthy and away from juvenile crime. Thank you so much for listening.
Thank you very much for your testimony. I appreciate it. So those are the only testifiers we have. Members, do you have questions or comments about the bill? Senator Hoffman.
Thank you, Madam Chair, and thank you, Dr. Senator Klein, for having the conversations with the tracks. There's one in Anoka County. You're familiar with that one, and I'm glad to hear that you're working through it, working through the concerns that they might have, and I appreciate your willingness to stay at the table with everybody so that we create a really vibrant sports betting in Minnesota. Thank you.
Senator Abler.
Thank you, Madam Chair, and just to the parts of the bill that's in our committee, I appreciate it coming here, and I appreciate the discussion. I have historically not been a supporter of gambling, although when each of my sons turned 18, they all went to the casino, and I didn't say don't go. So there's a certain fun to it, but there's a certain hugely addictive quality to this, which I'm glad you're putting the money into it, but that means, there's a problem, not you, just the plural you. And so this is as addictive as crack to some of these people, and I have a hard time not seeing the faces of some of the families who have crashed and burned because of this. And so I know you're aware of that, and I'm glad there's some money there, but that means there's going to be harm. Same as in the marijuana bill, we're putting guardrails to handle the treatment side. So I just don't know what to say about that. It's if you ask my district, they would say, oh, go ahead and legalize it. But I don't know if they know what they're asking for. It's comments you might have expected. So I have a question on line 4.4128 and so on. There's 60 hours of intervention. How did you come up with that number as the number for the treatment program?
Senator Abler, can you state the line again? I'm sorry, I didn't.
Page 41, line 28 to 31. It's the 60-hour program piece. Is that like a standard program, or is that a number somebody just kind of made up? Or?
Senator Klein.
Madam Chair, I may have a different draft of this bill. 4128 doesn't allude to any hourly requirements that I can see.
I live first in Grossman.
What I can tell, Madam Chair and Senator Abler, is that I don't have a lot of insight as to why that particular number was chosen. I'd be glad to work with you if you have ideas about it going forward. I would like to also address your other comments regarding the high risk of addiction in this in legalizing sports wagering. Surveys have demonstrated that in states that have legalized sports wagering, participation rates in sports wagering are identical to states that have not legalized it. That is, people are doing this, whether we decide as a state to legalize it or not. The only benefit we get out of making it legitimate and legal is that we can create some of these guardrails and safety nets around addiction behavior. So I feel satisfied that we are not creating harm.
And Madam Chair.
Senator Abler.
And I came to listen, so I'm just telling you my concern, and I just still these people in my head. Does somebody know the demographic of the people in compulsive gambling programs? Does the department here know, or somebody?
We're just looking
Like
around.
income
I'm not
status,
sure
race,
if
and all that.
the department, yeah, Christy is shaking her head, so I don't know if, but she's now coming forward.
Seriously, I didn't
so.
mean to drag her up here. Holy cow. Ms. Graham, good morning. You have to stop coming to these meetings, and you won't get called up there.
Good morning. Please introduce yourself, and if you have information you can provide, that would be helpful.
Madam Chair, members, Christy Grom with the Department of Human Services. Thanks for the question. I think it's an important one. I don't have the demographics on hand. I can certainly go back and bring those back to you. So sorry that I don't have a very satisfying answer this morning on that.
No, I appreciate that, but and this is back to my original question. Who are we? Who's failing in this system? And is it a different group that fails if it's easier to get there? And so maybe the number, I don't know. I don't know this topic very well. I just know the heart of my concern. And thanks. But I would like to know just that. And then, Madam Chair, I just have one more question.
Do you want me to hang on?
Senator Abler.
And I guess it's not our area really, but section 3 on page 42, this young adult, study on motivations and beliefs of young adult gamblers. So I'm just curious. I can tell you what they're going to say. Hey, I can get rich, and it's going to be amazing, it's fun, and nothing bad's going to happen to me. But because those results could touch what kind of treatment might be necessary, et cetera. So Senator Klein, do you know offhand what, so here's a $150,000 study about the beliefs of young gamblers. So do you know what you think that's going to accomplish besides spend $150,000?
Senator Klein.
Chair Wickland and Senator Abler, we both work in the medical field. Knowledge is power. You have to study a problem in order to understand it and address it, and I think the study aims to solve that.
Madam Chair, I
Senator
do believe
Abler.
knowledge is power. Thank you. That was one of the most amazing answers I've ever heard from you, Senator Klein. Thank you.
Thank you. Other member questions or comments? Senator Utke.
Thank you, Madam Chair. And Senator Abler's comments were kind of where I would have been heading. But I've got something that it's not really on our jurisdiction, but for curiosity, when they participate via the internet, log on mobilely, who do they connect up with? Because I know that the fact is, this is working with the 11 tribes. If you went on site, you'd sports gamble, I would imagine. I've never done it. But if you do it mobilely, who are they connecting up with?
Senator Klein.
Madam Chair, the bill provides that there will be 11 licenses over these sports wagering licenses, but then there will also be 11 platforms established, and an individual Indian tribe can either establish their own platform on their own, or they can contract with one of the products that you're familiar with, such as FanDuel, Sports Kings, et cetera. So it will be one of those types of platforms.
Senator Utke.
That's all. Thank you.
Okay. Members, any further comments? Not seeing any other questions or comments. Any closing comments, Senator Klein?
Thank you for the attention of the committee, and I think this next goes to Judiciary, Madam Chair.
That's correct. And I appreciate your presenting the bill in our committee, and I guess I want to say I support the fact that we are trying to regulate with the intention of being more intentional about training and guardrails. So I hope that we are also able to get information after we implement it to understand kind of what the results are and see if we are implementing enough guardrails. But I think that's the path to getting a better handle on something that people are, as you say, are already doing today. So So let's see, would Senator Senator Morrison, would you please make the motion that this bill be referred to the Committee on Judiciary and Public Safety?
Madam Chair, I move that Senate File 1949 be passed and re-referred to the Committee on Judiciary.
Thank you. Members, all those in favor, please signify by saying aye. Aye. Any opposed? No. The motion does prevail. The bill is passed, and Senate File 1949 is referred to the Committee on Judiciary and Public Safety. Thank you, Senator Klein. Next, we have Senate File 1799, Senator Utke. Thank you, Senator Utke, for presenting Senate File 1799 today. And please go ahead.
Okay, thank you, Madam Chair. Good morning to members and everyone. We have, or I have Senate File 1799 before us today, and I guess I'd like to start out with, we were handed out an amendment, the A1 amendment. If we could adopt that probably first. The amendment is just bringing the dates current. When we had the bill drafted, we were back a year.
Thank you. Senator Utke moves the A1 amendment. All those in favor, please signify by saying aye.
Aye.
Any opposed? The amendment is adopted. Thank you.
Okay.
So
Thank you,
go
Madam
ahead.
Chair, and members for doing that. And this is a bill that we've been working on for a few years. So those that were on the Human Services Committee will say, I've seen this before, and they have, and that's good. This is a bill relating to community support through volunteerism. Volunteers are the VIPs in our communities. From young to old, volunteers come in all shapes and sizes. And in a lot of our communities where people like to live after they retire, the abilities and expertise that these retired individuals can bring to the table is immeasurable. This bill is brought to us by the Minnesota Association of Volunteer Administration. One of their volunteer organizations, Becker County Energize, is a county-wide organization that I'm very proud to have next to my district. And that's what started this all off a few years ago when I had a chance to meet with them and see all the good things that they were doing in and around the Detroit Lakes area, doing wonderful things all through volunteerism. And that's what this bill does, is it just adds the organizational side to bringing volunteers together and getting them all working on a common goal throughout the state. And in the bill, we've got subgrants, and these subgrants will help minimize disparities in access to human services through increased volunteerism, and that's where we're putting emphasis on with this bill, is on the human service side. Successful subgrant applicants must demonstrate that the populations to be served by the subgrantee are considered underserved or suffer from or at risk of homelessness, hunger, poverty, lack of access to health care, or deficits in education. We realize daily that we have a lot of unmet human service needs across the state. The Minnesota Association of Volunteer Administration and their extended volunteer members are willing and able to help support and fill some of these unmet needs. They are eager to expand their horizons and take on this wonderful mission. Like everything we do, there is a financial need, and this bill is a one-time grant appropriated at $1 million. Plus, with that, there are requirements to report back the outcomes. Once they have accomplished this mission, they will return to the legislature and tell us what good deeds they could do and did with this appropriation. So let's see what they can accomplish with a grant like this. And with that, Madam Chair, we do have some testifiers, and if available, the first one up is Annette Duncan, and she is joining us via Zoom.
Yeah, Ms. Duncan, if you can please state your name and begin your testimony.
Thank you, Madam Chair. My name is Annette Duncan, and I am the president of the United Way of Steele County, located in rural Minnesota, Owatonna. Thank you, Senator Utke, for bringing this forward. I appreciate the opportunity to be able to speak on behalf of why volunteerism and creating organized structure around volunteerism is important, especially in rural communities. Senator Utke, you brought up the Becker County example, and that's just one of thousands of examples and opportunities that we have here in Minnesota, especially in greater Minnesota. In that example, the community came together, completed a needs assessment, identified a need, and were able to rally volunteers to meet that need. And what came out of that was a youth center. Much like that here in Steele County, during COVID was when we had our first opportunity to work with MAVA, because we, as a United Way, work with many nonprofits. And we were trying to identify what was preventing our nonprofits from being able to meet the needs of their clients during that environment, and identified that the volunteers that they had for many years were no longer able to come out. They were at risk. And so they really needed to have new volunteers. And through a very small grant from MAVA, we were able to bring together Volunteers United here in Steele County, bringing together hundreds of volunteers and thousands of hours that we were able to allocate to nonprofits across Steele County so that they could meet the human service needs in our communities. This continues today. We ourselves completed a gap analysis this past summer, identifying 3 high-level areas, one of those being teen mental health being a huge concern in our own community. And from there, we've brought together volunteers from the community, the youth from the community, and are also on track towards a youth center here as well. But that can't happen without the support of volunteers to bring that work forward, because many of these nonprofits, again, funding is minimal as it is. And so a lot of the work, the heavy lifting, is done by volunteers. And so what MAVA's been able to provide to us and will be able to provide to many nonprofits across the state is that structure, the ability to organize volunteers and to create programs that allow for more volunteers to be put out into our communities to do this work so that every person in our community has the opportunity at a better quality of life. And so I thank you for hearing us today. Thank you for the opportunity to testify today. I am very passionate about this. I am a lifelong volunteer, and it is because of the structures that are in place that make that possible. And I'd like to be able to afford that opportunity to everyone in Minnesota. Thank you.
Thank you. Thank you for your testimony. And now in person, we have several testifiers. If you would like to tell me who would like to go first. I have 3 names, but if you just want to.
Madam Chair, I think we'll start to my left is Dana, and then when we get to the next to my right is Jennifer.
Great. Please state your name for the record and begin your testimony.
My name is Dana Thewis. Madam Chair Wickland and members of the committee, I'm the program coordinator at Community Partners in 2 Harbors. We serve people and their caregivers who are 55 plus with services to help them remain in their homes independently as long as they're able. In rural areas, volunteers provide the life-giving services that are needed for our community members to live independently and age in their own homes. Through a collaboration in 2 Harbors, volunteers do things like deliver Meals on Wheels to folks who are homebound. Currently, we're serving about 60 people Monday through Friday. And this includes during times like the storm we had this last week. On Monday, I called my volunteers, one of them who's delivered for probably the last 5 years. He told me, well, looks like the streets are clear. Looks like the alleys have been cleared. There will probably be some snow piles, but I've got boots. For our seniors who receive these meals, this is the meal that they're going to get that day. Most of them will eat about half of it at lunch and half of it at dinner. Or they'll have like a peanut butter sandwich at lunch and then save the meal so that they can have something larger for dinner. For participants who need assistance to access to groceries, volunteers also provide grocery shopping and delivery. Our local grocery store isn't able to provide delivery. They don't have capacity to do curbside delivery. So we have volunteers who go in, shop Wednesday mornings and do deliveries. Right now, we're shopping and delivering for about 18 households. Volunteers shop for anywhere from 1 to 4 households a week. One of my volunteers will go in, shop for 2, deliver, go back, shop for 2 more, and deliver to them. And if ever another volunteer is unavailable, he will step in and sub and fill, because if folks can't get their groceries, they aren't able to eat. It's not a matter of this is the best option. For a lot of these people, this is the only option. In the past few weeks, we've started a new collaboration with a day program in Two Harbors to hire people with disabilities to provide light housekeeping services with the assistance of a job coach. We have participants who are unable to do things like laundry and washing floors. And so with the assistance of this program, they will be able to maintain their house, maintain the cleanliness. And we were unable to provide this service previously because we didn't have enough volunteers. A lot of folks who do house cleaning do it as a job, and the number of people who are providing this service is decreasing in our area, as well as the cost increasing. For most folks who do house cleaning in our area, it's $25 an hour. Our participants are on limited incomes. That's not affordable. So because our care navigator, our social worker in our office, works with the county, she's able to provide this service through waiver billing. And then we can work with the DAC, Developmental Achievement Center, to hire their consumers as employees of community partners and provide the service. We also provide friendly visits, social events, and navigation of services. The majority of our services are provided by volunteers. Our office currently serves over 300 people with the assistance of about 150 volunteers annually, and there are only 3 paid staff in our office, 2 full-time and I'm part-time. Funding and support from MAVA is necessary to provide these services because MAVA provides training, webinars, and networking opportunities. In a community such as Two Harbors, our volunteers work with multiple organizations. They are not just my volunteers. They work with the food shelf, the library, anywhere in town, the hospital and the clinic. They provide rides. So we have to work together, our organizations have to work together so that we're supporting our volunteers. So we're not trying to schedule them multiple times in one day, things like that. The grant from the state will allow organizations like ours to be more innovative in how we work together to engage local volunteers to address life-saving needs of members of our community. Thank you.
Thank you very much for your testimony. And now Ms. Galvin Bautista.
Good morning, Madam Chair and members of the committee. My name is Jennifer Galvan Bautista. I am a cabinet member with the Young Women's Initiative Cabinet, and I am also the manager of volunteer services at CLUES. CLUES is a nonprofit serving the Latino community. Our mission is to ensure the advancement of social and economic equity and well-being for Latinos in Minnesota. CLUES has a team of about 150 staff members and 550 plus volunteers annually. Volunteers serve in all areas of the organization, from administration to frontline work and providing direct support services. Our largest and most in-demand programs are operated almost entirely by volunteers, including distributing emergency and healthy food resources through our food shelf, Canasta Familiar, every week to 350 plus families in the Twin Cities and Greater Minnesota. Volunteers also teach our adult basic education classes, which includes 4 levels of ESL classes, computer literacy courses, as well as GED and citizenship test prep courses. Volunteers also bring thousands of dollars back into our community's pockets annually through our VITA Tax Prep program. Many of our volunteers are students and youth who are looking to gain transferable skills and experience, and some of our volunteers are also undocumented community members who are currently unable to work but have lots of valuable skills to give to the community. I've been with CLUES for almost 5 years, and I'm very proud of the work and the impact that our volunteers make every day. However, my department, just like many other volunteer departments throughout Minnesota, continues to be understaffed and underfunded. I managed this department and this entire team of volunteers by myself for 2 years through a pandemic as a result of my already underfunded department lacking funding. State funding will provide much-needed financial support and job security for volunteer engagement professionals throughout Minnesota. It will also support CLUS's volunteer department so that us and our volunteers can continue to grow and serve our Latinx and migrant community in Minnesota through meaningful and engaging volunteer service experiences. Please support Bill SF 1799. Thank you for the opportunity to testify. I'm happy to answer any questions you may have for me.
Thank you very much. We have one more testifier on the list, is that
Madam
the
Chair,
case?
yes, there was another name on the list, but they didn't make it. So
Okay.
this is the extent of our testimony.
Great. Well, thank you. Thank you both for coming today and testifying. Members, do you have any questions or comments about the bill? Senator Abler.
Thank you, Madam Chair. And, this is a worthy project. I just have a suggestion, in maybe you can find some money for this group. I think we did this in our bill. The Senate voted on this.
Last year we did.
Yeah, and most of us voted to do it. But just a suggestion, if you're going to do one-time funding, maybe you want to just extend the available date until longer. If you're going to find that kind of money, if it's this number or a different number, just available until expended or something like that. Thank you.
Thank you, Senator Abler. Any other comments, questions? Well, it certainly, I certainly think that the efforts, we depend on volunteers for so many different activities in the state, and I appreciate hearing about all of the essential work that they're providing in these communities that have testified, but I know it's all across Minnesota that these needs are present. Senator Utke, do you have any other closing comments?
Thank you, Madam Chair, and I think most of it's all been said very well by our testifiers and comments by members, but this has been kind of an ongoing project the last few years for us here at the legislature, trying to add to or assist by adding a little money to their program for something that they're already doing a very good job at. But as we hear, if we're able to move some additional funding their way, they can do a lot more in the line of helping people across the whole state. So that's what we're hoping to do. So thank you very much.
Oh, thank you. And this bill will be laid over for possible inclusion in a bill at a later date. Next, we have Senate File 1260. Senator Hoffman. Good morning, Senator Hoffman, and please go ahead and present your bill.
Madam Chair and members, thank you for hearing Senate File 1260. This bill appropriates both one-time and ongoing funding for community action grants. If you look at fiscal year 24, $2 million one-time funding, and then you look at 24-25, the biennium, there's ongoing funding. So just to get to Senator Utke, because he will ask that question, where's the fiscal note on that? I wanted to make sure that's the first thing I said. Minnesota Community Action grants provide flexible funding for Minnesota community action agencies and tribal nations outside of Shakopee, Minnewacan, and Sioux. Flexible funds allow grantees to be nimble and meet the emergent and growing needs in their communities. Madam Chair, this was especially necessary during COVID and throughout the recovery from the pandemic, as agencies had to quickly pivot to meet the growing and pressing needs. And this happens frequently with natural disasters, flooding, snow, any community economic hardship like an employer closing, etc. And so some examples how the agencies have been used. There's an agency in southeastern Minnesota that spent over $400,000 on rental assistance during COVID-19 to keep people safely and stably housed. This was done prior to the Rent Help Minnesota launching. Boot Drive for the agency based in the Iron Range provided 600 pairs of shoes to kiddos in need in the range, and over 700 pairs of boots to keep the children's feet warm and safe during the winter. Other ways that the increased funding will be is allowing agencies to expand their car repair programs. That makes it accessible to reliable transportation because it's needed across the state, and essentially to finding and maintaining employment, the transportation piece. Relatedly, some agencies use the grants to provide other transit support like passes that help with car insurance, emergency services like services for people experiencing homelessness or housing instability, and additional funding for emergency food programs and water and utility bill assistance. Madam Chair, it's absolutely a treat. The last time I got to sit next to Bill Grant was when we did the solar standards in 2013, and here he is with Community Action Partnerships. And then you also have Emily Bombich, who's from the Arrowhead Economic Opportunity Agency, and she's on the Zoomerang. So I don't know if you want to go first on the Zoom or you want to go with Mr. Grant.
We can go to the Zoom testifier. Ms. Bombich, if you would please state your name for the record and begin your testimony.
Thank you, Madam Chair and members. My name is Emily Bombich, and I'm the Director of Planning at Arrowhead Economic Opportunity Agency, better known as AEOA. And our main agency is based out of Virginia. However, we have other buildings around the area. Our Community Action Agency provides key services to people with low incomes across our 3-county service area on the Iron Range and including northeastern Minnesota, which include services like Head Start, transportation, energy assistance, housing, and services for people experiencing housing instability, and food assistance and emergency food programs. During COVID, we realized the needs in our community and across the Iron Range were growing, and our agency needed to start thinking outside the box to meet these growing and emergent needs by launching new pilot programs. Prior to the pandemic, we provided congregate dining and meal dining delivery services to older adults across the region. But with stay-at-home orders, we began to do produce distribution, which allowed community members who needed or wanted to come and pick up a box of produce. Over the past 2 years, we have distributed over 98,000 boxes of food, which equals over 2.25 million pounds of food to our community. Another need we identified was the need for shoes and boots for kids, and it truly stays at the forefront of AEOA staff that the idea of kids on the Iron Range, with the feet of snow that we've had this year, are unable to afford winter boots that could keep them safe, healthy, and warm. Over the past 2 years, we've provided back-to-school shoe drive and winter boot drives, providing over 600 pairs of shoes and 700 pairs of boots to kids in our area this year alone. One of the stories that I can think of and always comes to the front of my mind is when a 10-year-old boy gets teary-eyed when you hand him a new pair of socks because he hasn't had new socks, and then jumps for joy with the new shoes that we gave him. Our Minnesota Community Action Grant funding allowed us to create and launch and deliver these pilot programs, and we've identified additional needs on the horizon in our community, including the need for affordable housing, clothing, and transportation, and car repair. As needs grow and change in our local area, MCAG will allow AEOA to meet these needs in our community and to create innovative and new programs and solutions in partnership with our clients and stakeholders. I'd like to thank you for your time today and for hearing this bill on increasing MCAG funding and critical funding source that allows us to meet the needs of our low-income Minnesotans in our local communities and rural areas.
Thank you. Thank you very much for your testimony. And now we have Mr. Grant.
Thank you, Chair Wickland and members. Good morning. My name is Bill Grant. I am the Executive Director of the Minnesota Community Action Partnership. MNCAP is the state association for the 24 community action agencies across the state, serving low-income Minnesotans with programs like Head Start, emergency food services, energy assistance, housing services, and services for older adults, and a lot more. The Minnesota Community Action Grant that we call MCAG is the backbone funding for the community action agencies and tribal nations around the state. MCAG is flexible in funding that allows agencies and tribal nations to meet the emergent needs in their communities and to pivot quickly during times of economic unrest in their communities. These needs are identified during community needs assessments that occur every 2 to 3 years. This was incredibly important during COVID as people with low incomes faced emergency public health and economic emergencies during the pandemic. Community action agencies stepped up and quickly shifted to meeting those ever-growing needs. You will hear more, or you just have heard more from AEOA about how those needs were met during COVID. Instead, I wanted to share that agencies have also pivoted quickly during other emergencies, as Senator Hoffman mentioned, like flooding and other natural disasters that are becoming more and more routine. And we know that people with lowest incomes are experiencing the slowest economic recovery from the pandemic compared to their peers. The needs are still great. Food shelf usage is up across the state with over 5.5 million visits to food shelves in 2022. We are facing an affordable child care crisis everywhere, but particularly in Greater Minnesota. And especially in Greater Minnesota, we have an aging population with limited support systems or ways to age safely in place. Community action agencies and tribal nations are well poised to meet those needs in every corner of the state. But we will need additional resources to do it and to pivot to meet emergencies as they come up. I urge you to support Senate File 1260, and happy to take any questions.
Thank you. Thank you very much. Senator Hoffman, any other comments before we go to questions?
No, Madam Chair. This is CAP agencies have been around for a long time. As a child, my mom worked for the Scott Carver Dakota County CAP agency in Watertown and then in Shakopee, Minnesota, of all places, and to see the food that they were, able to prepare, meals they were able to prepare, and for our elderly. And now I think it's really important, as we have 1.3 million people 65 and older in the state of Minnesota, and of course, the needs are out there just because of the work that you and I have done for years. So I appreciate you hearing this and hopefully moving this bill forward, Madam Chair.
Members, any questions or comments? Senator Ebler.
Madam Chair, I didn't want to disappoint you. Again, this is such a white hat group. I'm just, of all the agencies that are effective, this is just the glue that holds it together. And so in the past, the Senate's been, as generous as they could be to try to improve funding, and whatever you can cobble together in your budget, from my experience, it will be used to stretch the pennies into dollars. So thank you, Madam Chair.
Absolutely.
Thank you. I just had one question. On the paper that we were provided about the organization, it states that currently funded at $4.9 million. Is that like for the last biennium, or do you know if you have more information about that? I appreciate it.
Madam Chair, yes, that is the current level of biennial funding.
Okay, thank you. And
it's a formula, Madam Chair. And it's a formula, Madam Chair, that's based on the area, the poverty area. That should also be in your handout as well. So.
Yep, and that's what it states. Yeah, it's allocated to the network by a formula. So, and you stated, Mr. Grant, that the each area produces their own community needs assessment. So that's what the grants are based on.
Yes, Madam Chair, and as you might expect, the needs are different in different areas, and so those needs assessments do produce different programming at the local level in response to those needs.
Okay, thank you. Any other questions? I don't see any other questions. Thank you, Senator Hoffman, for bringing the bill forward, and this bill will be laid over for possible inclusion in a future bill.
Thank you, Madam Chair and members.
And next we have Senator Abler, Senate File 2249.
Thank you, Madam Chair. And
okay. Excuse me. It's 2499.
Right.
All right.
Good. Any bill you
Senator
want, Madam
Abler.
Chair. Welcome to March Day at the Capitol. Minnesota, as you know, has a very broad-based but challenged network of helping individuals recover from their substance use challenges, and this committee is no stranger to a lot of these topics today. And you may be visited by people relative to substance abuse, and I know that this committee has historically been very thoughtful and sensitive to all that. This is the bill that is coming forward this year from the group, and it talks about people re-engaging post-treatment, talks about the need for some of their identification issues, transition efforts about and some rate issues, which will be covered by my testifier. Madam Chair, I know, just not to talk you out of helping them with their rates, I know there's going to be a lot of challenges in your budget. I have no idea what your target might be. But some of these, you'll hear that some of these groups are very much under challenge to acquire staff and actually be successful in helping individuals succeed in treatment because they can't get it. Other individuals that otherwise would succeed if they had the chance to avail themselves of that opportunity. So with that, Madam Chair, I'll turn it over to Mr. Zerbis, who can go through the bill in detail.
Senator Abler, there's an author's amendment.
Oh, that's right, yeah. Thanks, Madam
Would you
Chair.
like to adopt the A2 amendment?
I'd like to move the A2. It has actually 5 lines to it, and it's pretty amazing amendment. It has some technical changes about birth records and IDs. It reduces the number 6 by 1/3 to 4, which is amazing. See, we're actually already reducing in this bill. That's actually just a technical reference. And then it defines annual as February. So I move the A2.
Members, all those in favor of the A2 amendment, please signify by saying aye.
Aye.
Aye. Any opposed? The amendment is adopted. So please, welcome to the committee, Mr. Zerbis. Please go ahead and state your name for the record and present your testimony.
Thank you, Madam Chair. Committee members, good morning. My name is Brian Zerbis. I work with North Star Behavioral Health, a substance disorder organization in Minnesota. I'm here representing MARCH, the State Association for Chemical Dependency Providers. I'll provide an overview of the sections in 2499. The first 3 sections are really focused on removing barriers. One of the things that we hear, providers hear from clients as they move to and from treatment or from place to place, they often get things lost or stolen. Some of those things include driver's licenses, birth certificates, and things like that. So these 3 sections identify that when an individual completes their treatment and wants to regain those important documents, they can obtain those and have the fees waived, which would reduce a barrier for them in paying the replacement costs for birth certificates, IDs, and driver's licenses. Section 4 is extending treatment plan reviews. Substance disorder programs have to do a weekly treatment plan review with their clients or every 7 days. Our language would be to extend that to up to every 28 days with some exemptions. If there's significant events or there's a need to update it more often, that would happen. But otherwise, counselors would be able to ease some documentation burden in their caseload. Section 5 touches on transition and follow-up counseling. This is really intended to focus on low-intense treatment services to have longitudinal care for individuals. One of the challenges programs have with individuals that have these low-intense needs is the documentation requirements for treatment plan reviews, doing comprehensive assessments, things like that, are added documentation or paperwork burden. So we'd like to reduce some barriers for individuals that are accessing counseling to reduce some documentation burden for counselors. Section 6 has a few parts in it. It's in the rate requirements section of statute. One part touches on billing for residential programs. Currently, programs bill in 3 different levels, high, medium, and low. Those programs have to hit 30 hours, 15 hours, or 5 hours per week, respectively. The challenge that providers have is if a client is sick or attending appointments or due to motivational issues, they may not want to go to group. So in that treatment week, that client may not be able to hit 30 hours. So that program, despite being fully staffed to provide intensive services, may not be able to be reimbursed at the level they're providing. So we're looking to have some language to be able to have the programs identify, one, that they're engaging the client, they're identifying the reasons why the person is dropping below, and also documenting their efforts to get them reengaged to be able to get back to that those needed levels. Within that, there's also a reduction in hours in a treatment week in recognition of federal holidays. Again, this is intended to provide some ease for counselors to do self-care. The last part in Section 6 touches on co-occurring requirements. Substance disorder programs can get a rate enhancement if they provide co-occurring services. A significant portion of that is having mental health professionals as a staffing component. So the language that was added in is to have one full-time equivalent or 25% of the counseling staff have to be these mental health professionals, whichever is less. So the program still would have a mental health professional, but for smaller programs, having 25% of your counseling staff be a mental health professional is a staffing burden. Section 7 is on substance use treatment effectiveness. What this section is looking at is substance disorder programs have to provide a significant amount of data to the state through the drug and alcohol abuse normative evaluation system. And other data gets reported. Providers would like to be able to get that data back in a meaningful format for them to be able to do program evaluations and identify kind of how they're functioning as compared to other programs. There's also language in this section that would have DHS work with providers to help develop this reporting system. Section 8 touches on temporary rate increase of 24%. This temporary rate increase would expire after there was a 2021 legislation to direct the department to do a rate methodology study. The department is kind of in the midway point. They're gathering cost data from providers. Actually, the deadline to provide that was last Friday, so that work is proceeding. But this language is really looking at having this rate increase be effective until the new methodology is implemented in a future session. Section 9 kind of ties into or touches that rate increase, identifying that 1/3 of that 24% rate increase must be included as a direct or as increases for payments to direct care staff. This language is actually modeled after the home and community-based services direct care increase from a couple of years ago and is intended to ensure that staff providing direct services like counselors, nurses, technicians, those folks are able to garner some higher wages and also to allow programs to be able to attract and retain top talented workforce. The last section is on transition support recommendations. On this piece is really looking at, again, focusing on identifying barriers that clients experience before or after completing treatment, having the department work with stakeholders across the state, representing both providers, but also having current clients and former clients be a part of this work group to specifically identify barriers and recommendations that touch on issues of housing, recovery safe housing, transportation, childcare, and things like that. The recommendations are intended to be done by December of this year. That concludes my testimony, Chair Wickland. I want to thank you for hearing this, and thank you for Senator Abler for carrying the bill.
Thank you. Thank you for the walkthrough. Members, the parts of the bill, or the part of the bill I think that is most applicable to our committee is Section 1, I believe, and if council can confirm that, the certified birth record portion.
Madam Chair, members, yes, you are correct.
All right, thank you. And so that's kind of the focus of our role here is to, to talk about that. We obviously, members have questions and comments about any part of the bill is fine. I just wanted to draw people's attention to that. And then this bill will be passed over to the Human Services Committee for discussion of, the aspects that are in that committee's jurisdiction. So, members, any questions? Senator, no? Senator Utke.
Oh, no, I actually don't. I think we worked on this last year. It looks familiar also, so it's something that we've had a number of conversations around, and it's good, so thank you.
So, Madam Chair.
Senator Abler.
And so, actually, I have questions about this bill from the department's point of view, but none of those are in this area. So maybe if I can just ask them to chat with me about it between the two committees. Mm-hmm. And with that, I think I'll just move the time for a motion, Madam Chair.
Yeah, I guess my question was going to be about this the first section about the birth record, accessing the birth records, has more work gone on how that process would actually be implemented? And maybe you can tell me more. I carried a bill similar to this last year, worked on it for a while, but then kind of left off there. So I just, if you have any updates on kind of the work that's going on to be able to provide a birth record. I think it's a recognition of of something that would be helpful to people, and I'm just curious about the process to implement that.
Yeah, thank you, Madam Chair. There has been, obviously, ongoing work, and I think trying to work through the process of how an individual would be able to apply, and having the substance disorder organization or the human services organization be a part of that kind of attestation process. This bill, as Senator Utke had mentioned, and you're aware, was introduced last session, and we've had a solid year in working on the entire bill with the department to get it in a good spot.
Okay, thank you. And Senator Abler.
Well, and then the question is, what budget's going to pay for whatever it costs. And Madam Chair, I don't know, Mr. Albrecht knows, has there been a fiscal note request on this bill?
Mr. Albrecht.
Madam Chair and Senator Abler, a fiscal note was requested on this bill, but it was amended today, so it will need to be revised.
Thank you very much.
Abler.
Well, thank you. And so whenever you want the motion, I'll make it. I appreciate the committee's time on this. And, just to my editorial on the whole idea about, substance use, if we kind of stop the supply of substances, maybe there'd be less people having to fix them. So anyway, I'll leave it at that. So thank you.
Okay. Thank you. And I think that there are many provisions in here that are worthy of examination, and and we'll be able to talk more about those in the Human Services Committee. And I'm sure you can continue to get assistance from the department on how they, would suggest implementing them. So,
thanks.
So yes, your motion would be to recommend that 2499 as amended be recommended to pass and be referred to the Committee on Human Services.
Madam Chair, that's a great motion.
Members, all those in favor of the motion, please signify by saying aye.
Aye.
Any opposed? The motion does prevail. Senate File 2499, as amended, is recommended to pass and be referred to the Committee on Human Services.
Thank you, Madam Chair and members.
Thank you. Do you have for her? Okay. And now I will turn over the chairing to Senator Mann.
Madam Chair, to your bill.
Thank you. Thank you, Madam Chair. I am presenting Senate File number 2229, and I have an A2 amendment that's been posted a couple days that is really the bill in the shape that I would like to present it today. It is the Great Start for All Minnesota Children Act of 2023, and so I would like to adopt the A2 amendment, and we will have, Ms. Hanford is going to walk through the entire bill and talk about the sections.
Very good. Senator has an author's amendment. All those in favor say aye.
Aye.
Aye. All those opposed? The amendment is adopted. Madam Chair, to your bill as amended.
Thank you. And I have some opening comments, and then I will let Ms. Sanford walk through the bill. Earlier this session, In a joint hearing with the Education Finance Committee, we heard the recommendations of the Great Start Task Force, which was formed in 2021 and charged with developing recommendations for creating an early care and learning system that would be, first, affordable for parents, secondly, provide access to high-quality experiences for children, and lastly, ensure that Minnesota's early childhood educators are equitably compensated. I was proud to serve on that task force with Senator Bolden and many others, and today I am pleased to bring forward to you the A2 amendment, which we adopted, which is a proposal for taking big and bold action on those recommendations this year. Excuse me. Together, we can work from this blueprint to make 2023 the year when we stop admiring the problems in the early care and learning sector and really move forward toward addressing them at the scale that is needed to avert a full-blown crisis. Excuse me. I want to acknowledge that this proposal includes and builds on work led by Senator Bolden on CCAP and in support of the early childhood workforce, Senator Kupek on the retention payment program, and Senator May Quaid on the early learning scholarship program. I would also like to acknowledge the broad and deep support among advocates in the early care and learning space, as evidenced by the letter that you have received in your member packets today. Before we do a walkthrough of the amendment, I want to address the investment side of the equation head-on. Cost modeling has been done on this proposal, and the cost is estimated to be approximately $6 billion per biennium. $6 billion is the cost of making up for our decades of underinvestment in young children and fully addressing those three big problems that I mentioned earlier. Lack of affordability for parents, lack of quality for kids, and early educators who are severely undercompensated. I know we won't be able to go that full distance this year, but I am committed to getting Minnesota firmly on the path toward this vision and to taking the significant steps that we need to and move forward this year. I'm very pleased to have gotten to the point where we were talking about what it is really going to take to make the kind of progress that families, communities, and our state's economy need. And now I'd like to ask Ms. Sanford if she would walk through the bill.
Please introduce yourself and proceed.
Thank you, Madam Chair. Thank you, Chair Wickland. Good morning, members. My name is Claire Sanford, and I am here on behalf of the Minnesota Child Care Association and was also a proud member of the Great Start for All Minnesota Children Task Force. And it is thrilling to have gotten to this point where we can present a way to operationalize those task force recommendations to you. Chair Wickland has laid out the main problems: quality for kids, affordability for families, and compensation for the early educators who provide this service. And we not only have broad agreement on those problems, but now broad agreement on the solutions, which are in the amendment before you. And for those of us in the early education space, for those of you who've been hanging with us for many years, to have broad agreement is a big, hairy deal. So I'm excited about that. This amendment will talk about both the long-term vision set up by Chair Wickland as well as short-term efforts on the way to that vision for immediate action and relief. To the amendment. In Article 1, we have the title of the proposal, Great Start for All Minnesota Children Act of 2023, acknowledging the work of the task force created by this body, which met from 2021 to 2023. In Article 2, we get to the meat of it. A key recommendation of the task force is the establishment of a new family benefit system that takes the best of our current Child Care Assistance Program, or CCAP, and early learning scholarships, bring them together into what you see before you, a new entity called Great Start Scholarships. This amendment specifies that the Children's Cabinet will lead development of this program in collaboration with the Commissioners of Human Services and Education. If the Department of Children, Youth, and Families proposal moves forward, which we are also very much in support of, authority would transition to the new commissioner of the Department of Children, Youth, and Families. We would have written that in, but who knew? You can't assign responsibility to someone who doesn't exist yet. So the Children's Cabinet is in there for the time being. So the Children's Cabinet and/or Commissioner is tasked with integrating the functions, administration, and funding from both CCAP and early learning scholarships in line with task force recommendations, as well as developing ways to include local community input, because there is no one-size-fits-all solution, and each community around our state will require or desire a different mix of options and ways to build them. We also want to maximize federal resources and flexibilities in these programs, specifically CCAP. Obviously, that is the federal-state partnership. Minnesota does not currently do this in many areas, and sometimes we put up our own barriers. The requirements of the new Great Start Scholarship Program are that it will be family-directed scholarships for families voluntarily participating in the program for any child not yet enrolled in kindergarten, birth to age 5. And provider eligibility includes the universe of programs that are licensed and rated or rated with parent-aware, school-based, and Head Start programs. In order to support this new system, which would be universally open to Minnesota families who wish to use it, also the development of an integrated electronic attendance tracking and payment system will be required. This will truly move the needle. Some of these are Office of Legislative Auditor recommendations from reports from several years ago to really modernize the system, make it work better for families, providers, and really increase program integrity measures. Amounts for the individual scholarships for families will ensure that no family pays more than 7% of their income for all children under age 5 in this program. That is a federal income recommendation that has been in place for many, many years, and we are nowhere near that. We have families paying 20% or more of their income for childcare right now. This is really the crux of the task force recommendations. These items, the 7% standard for families, and subsidy amounts for providers that truly relate to the cost of providing quality services and paying those who provide those services. We won't achieve that transformational vision overnight, of course, and the task force knew that and deliberately set forth both that North Star vision as well as short-term recommendations to bring immediate relief to families and providers while that larger infrastructure is developed. And that's what we'll move to now, the short-term recommendations. Article 3 makes changes to the Child Care Assistance Program. It amends the definition of family so that foster parents, custodians, and guardians are also eligible for this support. It includes an annual cost of living adjustment between market rate surveys to make sure that people's compensation doesn't fall behind in the years between adjustments. Most importantly, it expands family income eligibility to the federally allowed maximum of 85% of state median income for family size. This would be a tremendous help for middle-class families and move income eligibility from where it sits currently, about $50,000 a year for a family of 4, closer to about $100,000 a year for a family of 4, well paying at the 75th percentile of market rates, which is also a federal standard. Article 4 makes changes to our current early learning scholarship program, such as, amazing, aligning income eligibility for families with the just proposed CCAP income qualification of 85% of state median income, working together across programs and agencies to make something make more sense for families. I know, revolutionary. We also add priorities, new priority groups to early learning scholarships. There are already priority groups in there, children of teen parents, children in the child protection system, but this would add some additional ones for children of incarcerated parents and children of parents dealing with mental health and or substance abuse disability issues. Also, low-income families, since we know we're not going to get the $6 billion right this second, low-income families will retain priority for funding, and there's direction given to the cabinet or the commissioner to expand income eligibility as resources allow so we can scale up the income scale. We also make some changes to early learning scholarships that would help to expand available capacity for children under 3 years old, where the supply and affordability crisis is particularly acute. In Article 5, we move on to a variety of both human and technological and administrative infrastructure supports. And I'm not going to go in the order they are in the amendment, because I put them together in something that made more sense for my head. But the two big pieces are the human pieces and the tech and administrative pieces. In the human pieces, we're really looking at a 5-piece workforce package here. We're looking at retention payments for childcare providers, universally available. These are in the governor's proposal. Senator Kupek has also championed these. These would pick up where the current child care stabilization grants leave off. The child care stabilization grants, right in the name, were meant to stabilize, not to improve, expand, or strengthen our child care system, and those payments are set to end with federal funding in June. The child care retention payments would start up after June of 2023. They would reach all providers on a non-competitive basis and award a monthly payment based on the number of FTEs. Also fixing a current issue that's of particular concern for our family child care providers. In the stabilization grants, people can only count as 1 FTE, but in this language, individuals would be able to count up to 2 FTEs based on the number of hours they work in a given week or month. And 100% of this support would be directed towards compensation for early educators. And this is following Great Start Task Force recommendations that in addition to per-child funding, providers should also receive some base level of operational support. Another piece of the workforce package is the further development of a wage scale for early educators to make sure they are compensated fairly and on par with their credentials and experience. Also further work on a cost estimation model so that providers are paid what they need to be paid in order to make sure their workforce is paid what they are worth. There's also an investment in the current Retain program, which recognizes current professionals in the child care field based on their individual level of education. And the final piece is a competency task force. Language is still being worked on here, but this is an integral part of this, and not all states are doing this. We are dedicated to the commitment to recognize our workforce of today, the competencies and skills they hold. Not everyone in our current workforce necessarily holds certain educational credentials, and we cannot leave their expertise behind. On the administrative and technological infrastructure side, this includes a task force recommendation to consider aligning Parent Aware with licensing, such that any licensed program automatically receives a 1-star rating in Parent Aware. And it also makes a significant information technology investment, which is hugely important. We are often told as advocates and others that we can't innovate, we can't do things that everyone agrees make sense for families and providers because the current IT systems just do not support it. So this would go towards modernization of those technology systems. Part of that is the electronic payment and attendance tracking system I mentioned earlier. I really hope Commissioner Fretham is testifying today and holds up her picture of what our current IT system that supports all this work looks like. It's unintentionally hilarious and really shows how much we need to make this investment. So that's a very quick run through of the high points of this. Thank you again so much, Chair Wickland. Thank you, Senator Bolden, also for your service on the task force. Thank you, Senator Bolden, Kupek, and Aaron McQuaid for the work that is recognized in this amendment. And we're just hugely excited to start Minnesota on this path and really be nation leading in this. Thank you.
Thank you, Ms. Sanford. Next up, we have Nicole Fretham. Please introduce yourself to the committee and proceed.
Good morning, Chair and members. I am Nicole Fretham, Ramsey County Commissioner. Prior to being elected, I spent over a decade in the early care and learning field as a child care provider, a policy specialist, an advocate, and also a participant as the mother of 2 young children. Despite a lot of studies and investigations and task forces, we've made little progress in providing affordable, accessible, and quality child care to all Minnesota families. We've celebrated small brights around the edges, but with over a $17 billion surplus, this is the year to take action. The Great Start bill is the transformational bill that I have been hoping for the last 15 years. This is for 2 reasons. One, By establishing a coordinated program, the Great Start Scholarship Program, it'll move the system complexity off families and childcare providers. Ms. Sanford's right, the technology piece is a big part of that, and as a county commissioner, I can say the challenges we have in getting case aids to manage our public assistance programs is real, and it's really because we're asking people to work with a system that was built in 1991. And for those of you who are familiar with the Child Care Assistance Program system, MEC squared, you might say it doesn't look like that. It does. MEC squared is just a GUI interface or a pretty mask over this system. I'm happy to share I made multiple copies. Secondly, it establishes early care and learning as a necessary educational and economic state program, recognizing that early care and learning should not be considered public assistance. It is about learning, education, and it's about economic development. For me, as a commissioner representing my constituents here, I really want to talk about how Great Start scholarships expand our workforce. And that's something we need right now with low unemployment and people desperate for workers. I sent a survey to families in my district to ask them about their childcare costs and experience. One family in my district, 2 parents and 3 kids, have an annual income of about $115,000 a year. That is just under 85% of the state median income for Minnesota. They reported that only one parent is able to work full-time. The other parent works part-time part of the year because the costs of childcare are too much, and their entire paycheck would go to pay for childcare. While investments in CCAP and early learning scholarships expanding eligibility to 85% is great, and you would think it would help this family, the second that other parent is able to earn more money, they'd be kicked off the program. Only Great Start scholarships will help this parent rejoin the workforce in the way that they want to. We certainly hear comments about, well, parents should stay at home with their kids. I have a lot of thoughts on that, but not every parent wants to. And there's a disproportionate burden that falls particularly on female parents who end up leaving the workforce, and that has lifelong consequences on their earning potential. Allowing these parents, should they choose to return to the full-time workforce, means they have lifelong earnings that benefit their family. They can invest in a college savings plan for their kids, which many parents forego because their child care costs more than college tuition at this point. But also it allows them to have Social Security income, independence, a chance for building their own retirement income. It's a huge driver, and having this program in Minnesota would not just help our current Minnesota families, we would become a mecca for young professional families and the best place for Minnesota kids. People would want to come here because not only would they enjoy all the benefits of living in Minnesota and the great jobs and careers, but they know they could do that without sacrificing everything to pay for our high child care costs. With that, I will conclude my testimony, but happy to share more.
Thank you. Thank you very much. We have a few testifiers on Zoom today. So we will proceed with Nicole Flick.
Hi. Can you hear me?
I think we can hear you.
Okay.
Yes,
Thank
please.
you, Madam Chair. My name is Nicole Flick, and I own ABC 123 Child Enrichment Center right outside the Fargo-Moorhead area. I've been working in this industry for 19 years, and I am a leader with Kids Count on Us, who organizes over 500 community-based childcare centers and family providers across Minnesota. Today, I'm here fighting for myself and my colleagues, just like me, who work 80 hours a week. We are attempting to be the HR team, the plumber, the teacher, the bus driver, the cleaner, the administrative coordinator, the behavioral coordinator, the curriculum coordinator, the cook, a spouse, and most importantly, I am also a mom of 2 young children who never get to see me because I show up for all the other moms and dads who need to get to work. Any school needs a team to operate effectively and provide quality care, and currently we are a team of 1. These funds would allow me and my colleagues to hire additional administrative staff, cleaning staff, and other support to properly run the small businesses we are. During the pandemic, most parents figured out how to work with 1 parent income and have the other stay home with the children, as that was the safest option. Since then, the cost of childcare has increased by 50%, and now those parents who stayed home cannot afford to come back to work. When the annual cost of infant care is double the cost of most colleges and universities, we have a huge economic problem. We need this bill to pass so we can fix the already broken childcare industry, get parents back to work in a cost-effective system. The Great Start for All Minnesota Children Act of 2023 would cap the amount a family pays for childcare at 7% of their income. This allows the parents to choose which type of care they want to provide for their children, not based on cost or availability of spots. The average pay for a full-time early childhood education teacher working in a childcare center in Minnesota is $27,000 a year. They receive no medical insurance and have no retirement benefits. To qualify as impoverished in Minnesota, a mother and her child is defined as making less than $32,000 a year. The majority of our teachers are young women that are starting families, building a career, and trying to make ends meet. This bill would allow me to raise salaries, provide benefits, and hire additional classroom support staff to help with behavioral, occupational, and mental health for our teachers and their students. Please support me in making the childcare industry a career by voting yes today. And special shout out to Senator Kupek for showing so much support for the childcare industry up in Moorhead in northern Minnesota. We are so grateful to be heard. Thank you.
Thank you, Ms. Flick. Next up, we have Shakira Bradshaw.
Hello. Okay, my name is Shakira Bradshaw, and for the past year, I serve as one of the co-chairs on the Great Start for All Minnesota Children Task Force as one of the parents on there with children in the EC system. I currently have 2 children in the center. We put forth a lot of recommendations, and of which this bill is based off of. So I said I have 2 children in the EC system. They're in 2 different centers in 2 different cities due to availability. So every morning I spend about 40 to 45 minutes just dropping them off at their 2 different centers. The 7% cap would be really beneficial for parents. Currently, as of last year, I took home about $42,000, and about 30 of that was spent on daycare costs alone. If I was a single parent, there's absolutely no way that I would be able to have my children in a center, which means that my income would not go towards our state's economy. Another thing that I want to highlight is just the provider wages. As was said earlier, they don't get paid very much. On average, a provider gets paid about $12 an hour. To kind of put that into perspective, Target employees start at $15 to $75 an hour, and they're not responsible for the health or well-being of children. They're not responsible for basically keeping them alive. And the impact that providers have on children is just monumental. My children have built lifelong attachments to their teachers. They see them and they view them as second parents. So when they leave the field because of a lack of incentives, a lack of livable wages, it really is detrimental on that children's health. My son lost 4 different teachers in a 4-year span at the center that he's at. And each time they left, he cried, he was upset. One of them left the day after. I guess he was naughty in the classroom. So he came up to me and said, "Mommy, is it my fault that you left? It's because I was naughty the day before." No child should have to feel that way. And no parent should have to spend a detrimental amount of money on a daycare center so that they can keep their children where they be safe and be able to also have a career. And that's just what I kind of wanted to speak about today. If there are any questions anybody has. Thank you so much.
Thank you, Ms. Bradshaw. Next up, we have Cindy Cunningham.
Greetings. Good morning. Hi, I am Cindy Cunningham. I have been a licensed family child care provider in St. Paul for 26 years. I am the current public policy chair for the State Association for Licensed Family Child Care, MCPIN. And I first want to thank you for the opportunity for a virtual meeting. Getting subs is next to impossible. And I'm happily watching 5 children you'll probably hear in the background playing. I had the privilege of being a member of the Great Start Task Force and was a community advisory non-voting member. And I attended monthly meetings with the full group and included participating in a compensation subgroup, also on a monthly basis. It was a lot of rich work, a lot of rich discussion, a lot of time spent. Much what is in this bill is reflective of the work that took place and is in line with the intent of the task force. The intention of supporting families, children, and those providing services, licensed family child care included, will accomplish the goal of the task force. Family child care is the culturally responsive and affordable continuity of care. I am the only one who sits here. I am the one that provides the same person at the door every day. Between the task force closure and the introduction of this bill, I have asked repeatedly to be in discussion on the 2 points that I'm going to discuss. And evidently, the task with bringing this bill, with those tasks with bringing this bill language forward. I have been met with silence. I come here to be heard by decision makers with the hope that I will receive a discussion and not the silence. Licensing, the two issues are licensing becoming the entry point as a one-star rated program. Those are praise and joy. I am a 3-star rated program. I have gone through many times on the rating system. I admin a Facebook page and encourage and support providers considering and entering into the Parent Aware program. We are not against Parent Aware. This step, though, that was proposed for licensing to become the 1-star rated program in the task force recommendations that were referenced previously was a proposal to have a working group, task, whatever, for us to evaluate the implementation and impact on those providing services and on the system. To implement the standard without such an evaluation skips over the concerns which I and many others in licensed family child care and the racial equity group have raised. We're asking for the evaluations prior to the implementation. The Parent Aware system has not been evaluated about how this step would even impact ratings, coaches, money, or anything. So it needs to be evaluated. I have included major points that are in your hands, should have my testimony. Large licensed family child care has a lower participation rate in Parent Aware due to very real and struggling situations. We frequently have a negative impact experience with coaches, language, computer process, and then raters who inconsistently apply decisions. One of the concerning factors in this, after you read through, is that the retention grants that were presented, we are pleased that they are being restructured, so it's not just the one FTE. However, there is language that if a provider chooses to not take the 1-star rating and opt out, they therefore then would no longer be available for those retention payments, or however they're being referenced. This is greatly concerning. We can't afford to lose any more family child care. We are an industry who has been cut in half in the last year, and we have reduced the numbers where centers and others have increased. Even though family child care is much more affordable than the high rates, the low cost or the low pay is under my jurisdiction, and I get to decide how my business runs. Some businesses struggle because of business models or locations, and so not everyone has has a high income, but they have the potential as a family child care provider. So again, we're asking that the evaluation and that was proposed in the task force recommendation be the standard on this, not to straight implement it. The second is on the competency task force working group. During the Great Start Task Force, it became clear that there was a striking difference in value of higher education and non-college training experience. Much of this is based on a national effort, Power to the Profession, which aims to towards comparable pay to schools and college degrees for providers. The competencies are also included in the Power to the Profession, yet there is a strong voice within the state that would minimize those. Child Care Aware suggested that these be set up to be phased out. I'm going to go to the end. It's critical that the Competencies Task Force be structured such that those who value competencies are well represented. As it is presented, the working group is heavy representation of those in higher education and other walks of life who have historically not valued training and experience. Many on the task force are somewhere in the middle. We're asking for an increase of family child care representation on the task force and assurance that those others involved truly have a respect for the full profession when making decisions, not an investment in the higher education standards through administrative fees and increased tuition. I personally know at least 3 family child care providers who have master's degree in education, who are trainers and highly invested in our profession that would be great candidates for this competency work group. They, however, would likely not be considered because they would first be looked at, the concern is they would be first looked at the one family child care provider in the metro or the one family child care provider in greater Minnesota. That is not enough to explain and support this competencies when it has reached such opposition and discussion. We're asking that these two aspects of the Great Start be evaluated in the bill we've reworked to fully support all programs equitably. Thank you.
Thank you, Ms. Cunningham. Senator Wickland, any comments before we go to questions?
Thank you, Madam Chair. I just want to say thank you to all the testifiers. I think they've given perspectives on from the parent point of view, providers' point of view, on some of the key needs that we're trying to meet with this bill. I do want to say that I have worked with Ms. Cunningham for many years. I think going back to the Family Child Care Task Force that I was on, which was several years ago. And so I hope to continue to work with her on any questions and concerns that she brought up about the licensing model and the competency task force. Happy to have more discussions about how to make sure, because family child care is absolutely essential for Minnesota to continue to have that type of provider available. And we definitely want that this bill supports them as well as all the other kinds of providers we have in the state. So that's all I guess I'd say at this point, but happy to answer any questions.
Members, questions? Senator Bolden.
I don't have a question, but just a comment and thanks to Chair Wickland for your work on this bill. I'm so excited that we are hearing it. I'm so excited to move it forward. It is the culmination of a lot of work over years. I'm really grateful to all those who served on the task force, and it really was a broad coalition, a broad array of different perspectives and different voices, and it as was said, it was pretty amazing to come to sort of agreement across those many perspectives, and so there's a whole lot of work that has gone into this bill, and it's, I think, a bit difficult to overstate how transformational it would be to put all of these things into place. And as we have talked about, it is a system in crisis, and it affects so many Minnesotans, and so making these changes would absolutely change lives. And so thank you for your work. There are so many things I like in this bill. I'll just maybe touch on one of them. One of my favorites is the cap on 7% of families' income to pay for childcare. That in itself, just that piece, would make a difference in so many lives. As was said, there's many families across the state who are paying 20, 30, 40, 50% of their income towards childcare. And it really is a barrier for many families. And so, as we talk about, our values and what we, want to invest in and who we want to support, it is families and young kiddos. And, we have a responsibility as a state, I think, to do that. And so this is a step in that direction. And so really, really important work. And thank you for bringing it forward.
Senator Abler.
Well, thanks, and thanks, Madam Chair and Senator Wickland. I see your fingerprints all over this. I know that child care is a passion of yours, and this reflects every bit of that. And so I just, I like a bunch of it, and some things are pretty expensive. And so is the department here to offer a comment? I'd like to ask them how they see this bill influencing, especially licensed homes. I can see it's going to, and I'm not, the centers, I'm wholly respectful of that, and they're going to be well squared away by this bill. I can obviously tell, so I don't need to ask that question. So Ms. Sanford, it's all good. But is there somebody here, Madam Chair, that could just comment about that? Because the discussion we have ongoing, I have just a couple other short comments, but if they want to come up,
I'm not sure.
Is that we've lost like thousands of slots, tens of thousands of slots through just the attrition.
Senator Wickland.
So the attrition on license, I was just waiting for the department to listen to my question. So through attrition, and I'm curious what stuff in here is going to stop that attrition? That's my question.
Can you repeat? I'm sorry, Madam Chair, Senator Abler, can you repeat that question?
Certainly. So, you've got a bill here that's going to I like the scholarships. There's 2.7 or better with the scholarships, $2.7 billion with the scholarships in here. That's a big number, certainly aspirational. There's some other projects going on in here. And, you know, Ms. Cunningham was offering some comments, which I really hope that you all take to heart. But what in this bill is going to stem the attrition in licensed homes from, it seems like the graph is this, and the graph on centers is kind of like this. So what in this bill will help that?
Please introduce yourself for the committee. Thank you. Madam Chair, Jennifer Sommerfeld from the Department of Human Services. Senator Abler, I don't have a cut and dry answer that I can give you for that. Yeah. The attrition of family child care providers is a nationwide issue, and the department considers it to be a really important one. That's one of the reasons that we have been moving forward with our own proposal regarding retention payments to make sure that we're supporting child care providers to stay open and operational for families. Yeah. I'd have to look at this bill and talk about it in a little more detail with my staff to be able to really dig in on the direct impacts for family child care.
Senator Abler.
Thank you, Madam Chair. Listen, I just thought you had some hand in writing this. So, anyway, so Senator Wickland, we talked about this. Thanks for being here, Ms. Sommerfeld. So we just talked about this, 90 times. I'm not here to. There's no press. We're not doing any big. This is just a discussion about how do we best serve families that need child care, and amongst those is like this forgotten section, which it seems every policy that comes out of the department makes it more difficult for them. They don't have the depth of staff. As challenged as centers are, at least there's more than one person kind of running it, and they know how to read all this stuff, and so they apply for the grants and all that, and I'm supported those. We put out hundreds of $1 million worth of grants, through COVID and all that, and I was a strong supporter of that. So going forward, we just need to find a way to stem the tide, because some of the very conversations about affording child care, especially in greater Minnesota, are licensed homes. And it's impractical to have a center because the draw area is too thin. And, how do we help? And as this goes, how do we help, like a manufacturing company, set up a 20-person center? How do we help them do that to actually get the child care where you need it, so it's the least amount of time away from the family and all of that. So I just have one other thing, and you have a lot of task forces and studies in here, and I'm particularly impressed with the one. I thought that was where'd it go? It's an amazing title. The Recognizing Comparable Competencies to Achieve Comparable Compensation, the RCC-ACC. I'm helping you out. So the RICAC. Anyway, so, it seems like a useful group, but just how many task forces have you and I put together, Senator Wickland? And, we're groups that are working on stuff. And so the more practical you can make this, the better. And maybe have them do some of the stuff here through a coordinated effort, so you have only like one place to go compared to the commissioner doing 4 or 5 things, and it gets lost internally, and you give them money, and then here comes their thoughts, and it wasn't even what you wanted. And then just a cautionary note, the wage report's going to come back in 2025, and it may well be that your caucus is going to give you a large budget for this project. I personally am concerned, as we spend the whole $19 billion on whatever, that we're going to be suffering some shortfalls coming in the future. And so if you're trying to do some things about wages, you might want to try to bake in some money to capture your share on the come against what's going to be happening. Because the worst thing that could happen is things turn flat, or there was, if you recall, the last economic forecast, sorry about that, was down a little bit in the revenue. And so you'll have these groups working together, coming up with, they should make a certain amount per hour, which I totally favor, giving workers in every place, try to get them to $20 at least if you can. And then here's this report, and you can't do anything about it. So anyway, those are meant to be friendly. So and this is a major project you've taken on, and I wish you the best in it.
Senator Wickland. Madam Chair, Senator Abler, yes, I appreciate your comments, and I think it is a major undertaking. I do think we want to continue to look forward yeah, at the years ahead, when we want to we would want to continue to sustain the work that we would put in place. In terms of family childcare, I do want to say over the past few years, we have been making it a point of emphasis in terms of representation in the task force, in terms of specific questions that have come out of the Great Start Task Force that need to be addressed relating to family childcare, and inclusion in the discussions about how do we increase compensation by studying things like the wage scale. I think that we will continue to have that focus because we know that there are areas where family child care is the primary type that can be available and sustainable, and we need to find ways to support those providers in terms of, recognizing their level of attainment in terms of competencies. That's part of that task force, is to study how do we make sure that people have levels of educational attainment. Some of them might be degrees, but other attainment is through experience and learning. And so we want to be able to recognize that and allow that to contribute to their increased compensation. And that's, definitely applies to family child care. So I think we'll keep working on that. There's obviously more that we can do to make sure we recognize. The department is working on a modernization of the licensing process, and that came out of work that we did on the Family Child Care Task Force specifically. So,
Madam Chair, just my
Senator
final
Abler.
comment. So I appreciate that, and I hope there's not a more knowledgeable person to work on this. I think in the Senate, what the House, maybe Senator Representative Pinto would argue that he's whatever. But anyway, there's nobody better gifted and knowledgeable to work on this project than you, and so I appreciate that, Senator Wickland. And so Ms. Cunningham said one other thing which provoked my thinking that I just want to encourage you about. Parent Aware, I think, has a great deal of use, especially in centers where they're so large and so many different things could be, emphasized. But I think in the licensed homes, sometimes it's not as practical. And if some of the licensees are less interested or frightened about just people coming to scrutinize whatever and have to hit all these criteria, you may actually find it counterproductive toward what you're trying to do by having less. And maybe that's just to caution you that some people just don't want to do it. And a good number of the licensed homes didn't do the grants because it got to be too little bit of money. And anyway, just to encourage you. So thank you.
Senator Utke.
Thank you, Madam Chair. First question is just kind of for curiosity on, this is page 33, and you get down to lines 27 and 28, where we get into the early learning scholarships. There's some pretty large dollars, and I was just running some of that through a calculator. How many young people do you figure fit into that amount? How many children would be served?
Senator Wickland or Ms. Sanford?
Sure, if you have you, you're talking about, Madam Chair, Senator Utke, on page 33, you said the number is like 33.25. Is that where you're looking?
Senator Utke?
Yes, that is correct, right. Under the early learning scholarships, and where we've got almost 600, or a little over 670 million each year. And I'm just curious to how many how many children are factored into that number.
And I have another testifier who could answer that question.
Go ahead.
Hi, Madam Chair and members, Erica Moss. I work at Think Small. I can do quick cell phone calculator math. Once you take the scholarship amounts to about the 75th percentile, where CCAP would be, and expand eligibility to 85% of state median income, you're looking at costs of around an average of $13,000 per child, ages 0 to 5. And so that is the math that would help you know. That would be 23,076 children, Senator Utke.
Senator Utke.
Okay. Thank you, Madam Chair, and thank you. I was just trying to, I was doing the same thing, cell phone calculations, and to see where you came up with. But now I've got a question, and I guess, first of all, maybe not, I think there's congratulations. I think this is the biggest bill I've ever seen. So you've done well to hit the $6 billion or whatever you started out with. But anyhow, the way this is put together, if something like this was to move forward, and looking at the rates out in our areas, and in rural Minnesota, the vast majority are all in-home providers. But you've got rates that this would have baked in, but we still have a number of people who private pay, and the provider has to charge the same. What is this going to do to rates? Are we going to see that rate going up so that the private pay people are going to be paying a lot more?
Senator Wickland, Ms. Sanford.
Thank you, Madam Chair. Thank you, Senator Utke. That is a concern, and we have heard that from providers, not just family providers, all types of providers, particularly in greater Minnesota. And part of the language in this bill, which came out of a bill for CCAP specifically that Senator Bolden has worked on, does have language that makes very clear that providers, if the rates do take a big jump right now, providers are allowed to provide any discounts they see fit to a family, including a private pay family. So they would not necessarily, they could make their own business decisions. They would not necessarily have to charge a private pay family the same as a new CCAP or scholarship rate. And that is intended also as bridge language to make sure we're doing no harm to families and providers while we move to a system of 7% where the vast majority of families would be covered, and that would no longer be an issue.
Senator Utke.
What if, thank you, Madam Chair, back following this private pay and the 7%, if this again was to be something that was put into law and worked, and if you were a private pay person and you had a decent income, are they able to pay their full allotted amount and not have to participate in this 7%?
Ms. Sanford.
Where they would be taking a subsidy, they just want to bypass subsidies?
Ms. Sanford.
Madam Chair, Senator Utke, yes, there would be nothing to prevent a family or a provider from opting out of the Great Start Scholarships program. But, you know, using the 7% of family income standard, there are high income families for whom they already make a high enough income that the 7% standard would not help them in any way because they make a high enough income where they are already paying the full cost of their child care and would not qualify for a subsidy. So if a family makes a certain amount and they would not pay more than 7% without a subsidy, they would not be given a subsidy in that sense. They would be universally available, but just as the math works out, the very high income families who have this at less than 7% of their income already based on the virtue of their income would not participate.
Senator.
Thank you, Madam Chair. And one last thing, and I didn't see it, I could have missed it too, but over the last few years, I know that I've worked on it and others have too, with our in-home providers trying to adjust the licensing as far as the age groups of children that they can have or serve in their homes. The current age grouping is really restrictive, and just wondering if any of that is in here or was considered or could still be considered as this moves forward, because that's an important piece, because there's limited, I mean, typically they're working from the, I want to say birth, but let's say from early age up to 3, maybe 4 years at the most, and then we start to have other things take over, and they're not allowed to serve enough kids to make their business model profitable for them. And that's what we were trying to do, is to put the flexibility in the hands of the provider, because some would handle more infants, some don't care for infants, but they would be able to adjust according to their needs, but where they feel most comfortable. And was any of that considered, or will you still consider some as this moves forward?
Ms. Sanford?
Madam Chair, Senator Utke, that is not specifically called out in this bill, because the complementary licensing modernization work for both family child care and child care centers is underway, that is looking at exactly those pieces. We're also looking at solutions, particularly around licensing for Greater Minnesota, that do allow different groupings of children, different amounts of children, different settings where things could be more like a family child care home, but not actually run out of a provider's home, run out of another space. So all of that is incredibly important and being looked at in the licensing modernization process already underway, which we see as complementary to this. And in terms of the family child care concerns, both you and Senator Abler spoke to Ms. Cunningham's points about the link between licensing and parent aware. And I just want to make clear there, because this is a very great concern for family child care particularly. There are known issues within the parent aware system that are also being worked on for providers. And what this bill is doing is not saying providers would have to go through the parent aware system as it currently exists to get a 1-star rating. Providers would have to do absolutely nothing different than they're doing right now. If they are already licensed, that would automatically become 1-star. So while there are concerns with parent aware and how it interacts with providers, particularly family providers in some cases, none of that would come into play here. They would automatically get the 1-star rating. They would not have to do anything in addition. And one more thing I'd say, Senator Utke, is that, well, obviously we always want all businesses, whether family or centers, to be able to run their business the way they are most comfortable, the way they see fit, and the way that is most profitable to them. The hope overall of something like Great Start scholarships is that providers would have to make fewer choices like that I need to serve more kids, otherwise I cannot make an income. Because we know that the number of kids served in ratios and things like that is of the utmost importance for quality for kids and for health and safety. So we're trying to move to a system where providers don't have to make those sometimes impossible choices by providing a system where they are paid well for what they do without having to make calculations like that.
Senator Morrison.
Thank you, Madam Chair, and thank you, Senator Wickland, for your leadership on this issue. Senator Bolden said it. I couldn't say it better than she did. She and I have talked about wanting early childhood care and education to be its own committee in the Senate, and hopefully in the future we can make that happen. But I want, we're taking on a lot of important issues this session. To me, this bill is one of the most important. This could be such a transformational change for the state of Minnesota. It bears repeating, and it bears pausing to consider the possibilities of what this bill could mean for our state. When we talk about the persistent racial disparities that we are struggling to make inroads in, this would make a huge difference. When we talk about our workforce challenges, this would make a huge difference. Young humans take a lot of care. They're expensive. We're different than other animals. We're vulnerable, and we require a lot of investment, and this bill reflects all of those things. I'm grateful to you, Senator Wickland. I'm grateful to Ms. Moss and to Ms. Sanford and to the huge coalition that has come together to create this. I am an enthusiastic supporter and just wanted to voice my support and to emphasize just the incredible importance of this legislation.
Thank you, Senator. Members, we have 1 minute. Senator Abler.
So much time. Anyway, so just a comment, a question. So I think you want to be careful about 1 star being considered something great to have. I can just tell future discussions, here's a 1-star provider, we got a 3-star one at the center, and it's going to be a pejorative. I'm concerned about that, just to remind you. And then, Senator Whitland, do you know how this interacts with the 4-year-old pre-kindergarten proposals? Is this interactive with that somehow? I'm not a big fan of the all-day pre-K whatever thing. And so that would, how does that work with this? I don't know if your side's going to do that, the governor wants it, but can you comment about that?
Senator?
Thank you, Madam Chair, Senator Abler. I will let Ms. Moss maybe answer. I mean, I think there is the hope that the scholarship would be possible to use up to the age, up to age 5, and so there would be kids using it for a pre-K program. And I don't.
Ms. Moss?
Madam Chair, Senator Abler, the Great Start Scholarship Program would cover ages 0 to kindergarten entry. Families would be able to choose among a wide variety of providers, including school-based Head Start and licensed childcare. In the instances where there are existing voluntary pre-kindergarten seats, for example, the Great Start Scholarship would wrap around and provide funding for those children to have before and after care and to cover summers.
Thanks. Madam Chair, I know you're short on time. Just a comment. So I'm very concerned about this all-day, whatever, the 4-year-old thing, which would cause nothing but harm to these programs. So just, that's my thought. So I'll stop. Thank you.
Thank you, Senator. Madam Chair, wonderful bill. Echo everything Senator Morrison said. The coalition behind this bill is some of the most amazing people I know. And so, again, also very strong supporter. Any closing comments?
Thank you, Madam Chair. I don't have any additional comments. I think it's all been very well presented. I really appreciate and want to thank the testifiers who have come forward today, and also thank you to the great coalition of advocacy groups and families and parents who are advocating for a strong start for every child and strong funding going forward this session so that we can begin to transform our system into what so many of you have very well articulated, what we need as a state to move forward, supporting every family and helping our economy at the same time. So thank you.
Thank you, Madam Chair. With that, we will lay over Senate File 2229. And earlier, members, we made a slight mistake and sent 2499 to the wrong committee. So at this time, I would like to take a vote to reconsider the motion on Senate File 2499.
Madam Chair, I'd love to go to the Transportation Committee instead. So
wonderful.
I move that, and you can vote.
All those in favor to reconsider, say aye. Aye. All those against? Motion prevails. The bill is reconsidered. And now, Senator Abler, would you like to recommend it pass and re-refer to the Committee on Transportation?
No, but I will. So I'll make that motion.
Wonderful. All those in favor say aye.
Aye.
All those opposed, no. The motion prevails. And with that, we are
in recess.
In recess.